Hello and welcome to our National Family Support Technical Assistance Center information session on the Family Partnership Training Institute, a wonderful new program that we are launching in December in collaboration with Boston University. My name is Dana LeBranch. I'm a project specialist at NFSTAC. Our project director, Gail Cormier, sends her apologies. She was not able to join us today, but I am also joined by Marianne Farkas, who's a clinical professor at Boston University, and she'll introduce herself in just 1 second. Thank you all for being here. All of our funding at the National Family Support Technical Assistance Center does come from the Substance Abuse and Mental Health Services Administration. We are so grateful for their support, but we want to make sure you know that everything expressed today does not necessarily represent SAMHSA's official views or is an endorsement of anything that SAMHSA or HHS does. Today, your microphones will be muted, and if you could please keep those on mute for most of the presentation today. There will be a chance to answer questions at the end of our information session today. You're also welcome to put questions into the chat throughout the presentation. We are recording this session, and we will get it up on the NFF YouTube page and the NFSTAC website within 14 days. You, as a registered attendee, will also receive a link to that recording as well as these slides about 5 business days after the information session or sooner. And if you have any questions at all, you can always email me. My email is there on the screen. It will show up again at the end of the presentation, and I can put it in the chat for you as well. At NFSTAC, we use family-driven language. We ask that you, during this information session, also use family-driven language that is trauma responsive, strengths-based, does not blame caregivers, is inclusive, person-first, respectful, non-judgmental, and consistent with our actions. At the end of today's information session, we hope that you'll be able to explain what this Family Partnership Training Institute's goals are and how we're going to meet them. We hope you can also share about it with your networks. And when I send you that follow-up email, you'll get a flyer that you can pass on to anyone in your networks. And we also hope you'll understand how to apply for the Training Institute. And I'm going to pass it over to Marianne to introduce herself.
Okay. Good afternoon, everyone. It's great to be here. Thank you, Dana. I really appreciate it. I am excited to be here at this information session. My name is Marianne Farkas. I'm a professor at Sargent College at Boston University, and I represent the Center for Psychiatric Rehabilitation, which has been in operation since 1979. And I hesitate to say that I have been there since 1979, but I have. And I see that you have my bio up there. I think what's relevant is that I am also a family member, and I have been working on issues of partnership, choice, person-centeredness relative to people with serious mental health conditions and their families for about 45 years. That's about all I want to say, Dana. The rest people can read if it's of interest. Not necessary.
Yeah, and Marianne is going to be the lead facilitator for the Family Partnership Training Institute. She was also a co-author of the course that this training institute was based off, which we will talk about in just a minute. Gail Cormier will be another facilitator for the Family Partnership Training Institute. She is unable to be with us today, but she sends her hellos. She's the project director of the National Family Support Technical Assistance Center. Before that, she was an executive director for North Carolina Families United, which was the North Carolina state affiliate of the National Federation of Families, who leads NFSTAC. She has been working in family-run organizations and family services for many years, and she is also a family member with lived experience of caring for a loved one with mental health challenges. My name is Dana LeBranch. I'm going to be the coordinator of the Training Institute, so I'll be the person that communicates with all of the participants and organizes all the technical and behind-the-scenes aspects of the Institute, and I will also be on each of those meetings to be involved in the discussions. I have a background in mental health research, as well as school mental health training and education. And I also have lived experience as a family member to those with mental health challenges. So we're going to start off with a survey. I will let you take that away, Mary Ann. Our colleague Lachelle is going to put a link in the chat to go to our survey. You can also go to www.menti.com and type that code in and just write in, how do you partner with families? Then I'll pass it over to you, Mary Ann.
Thank you. People are either deep in thought or they don't partner with families, which I find difficult to believe.
It's just taking a minute to
Just write down whatever comes to your mind. At the IEP table and helping them to find services, great. Supporting and empowering unpaid family caregivers, the backbone of the nation, to prevent caregiver burnout, really important. Helping to make sure they have the resources they need. Partnering with people to navigate the system. Providing support in accessing mental health and behavioral health services. Working to help people feel empowered and use their voice. Providing support throughout the journey. Find resources. Navigating the system. Someone's a certified peer partner. Can you scroll down a little bit, please? Thank you. Show them hope. Okay, I think we have the flavor here. It looks like many of the people who answered are involved in what I would call instrumental tasks. In other words, involved in doing things, activities with people in order to help them to get or link to resources that they need and want. And there are some others who are focused more on the emotional landscape and talk about helping to empower people to advocate for themselves or find their voice, etc. And some people are themselves families, family members, and a certified peer partner. So they're more focused on the interaction. Somebody said training family peers how to advocate. Great. Okay, so we essentially put this course that we call the family approach, which I'll talk about in a minute, together because we wanted to reach providers who work with families. Because we felt that, and there's a fair amount of data to support this idea, that there's kind of a lack of partnership in the average clinic or helping situation between providers delivering services and families receiving those services. So we started out with a very narrow focus of a certain kind of provider who was sort of the ones that came to our minds first. And then as we started to work on the course, it grew and it developed and evolved into really a cross-section of providers. And we got some of our ideas from a survey that Dana really ran on asking people in the field how much training they had had in creating family partnerships and when that kind of partnership had actually occurred, or that kind of training had occurred. And what we learned was that, as you can imagine, there wasn't a great deal of training. There were a lot of training for families, a lot of training on working with families that were more pathology oriented, how to fix families, what's wrong with families, how to create links despite what's wrong with families. And I'm making a broad generalization, and it's not relevant to the people who are here because you're here. But the survey really pointed that out, and that whatever training did occur, and these are people who graduated from different discipline training programs in colleges. I think, was it within the last 5 years, Dana, or something?
No, we
Recently.
had a wide range of people, but
Oh, we had
most people had graduated in the last 8 years.
Yeah. Well, fairly recently, if you're a person like me who's been around for many decades, 8 years or 5 years seems fairly brief. And so we found that kind of shocking. A, that there wasn't a lot of training available. B, that people got the training that they did have kind of late in their career, and that a lot of the training they had was really responding to this kind of fix the family mentality, again, in broad generalizations. So in order to try to put some of the research and the findings from the literature together in a way that was not so unwieldy, we came up with this kind of cutesy title, The Family Approach, where each letter represents one of the modules. So F is for facing personal and professional attitudes. In other words, how to help yourself get rid of these biases that often live in the mental health system and also in the school system about families, about the role of families, about what they can contribute or not. Acknowledging family identities and expertise, acknowledging the range of different family types that exist, the sense of identity and the expertise they bring to the table and how to do that, what it takes to make a meaningful partnership. And the last three, the I, the L, and the Y, are really more about trying to help the providers to understand that partnership doesn't always mean agreement with families. It doesn't mean that all the parties in the room have to agree. There has to be a method of respectful solutions to conflict. So there's a module on that. Letting go to support, knowing when to let go, when to make space for the situation to evolve as it should or could. And yielding to outside supports has to do with professionals and providers in the mental health field really being willing to acknowledge that, number one, they aren't the solution to the problem. And two, that there are a whole range of supports, professional and not professional, natural and paid supports that are important to harness when you're creating a partnership with families in a network. So in very broad terms, those are the modules that are in this particular course that we created the online elements for. So I want to show you for a few minutes one of those modules. Maybe let's go to the one that seems most difficult to understand. Well, let's go to yielding to outside supports, just as an example. So each module has some sub-modules. Stop for a second, please. You'll see that this module has to do with how to connect to family peer specialists, how to link to meaningful resources, and then an evaluation component because the course is complete. So each of the modules starts in the same way. There's some kind of quote that is relevant. There is some, can you go down a little bit, please? It tells you what the lesson does, what the content is that's going to be covered. And can we go to page 2? And then how to do each of the sub pieces. So there are usually examples and very brief. Can we keep going? Thank you. Very brief exercises that you're invited to participate in. There's the practice pause on each page to help you kind of process and absorb the information. So this module is 4 pages in length. Let's see, the third one has to do with the next element, which is linking to meaningful resources. It gives you some information about that. And then there's a practice pause. And then it gives you some resources that you can investigate further if you're interested in this topic. As I said, each of the modules is organized in the same way and is very brief. The intention here is to give you an exposure to each of these elements, to raise issues that might be of interest to you, to give you a little example of something that you can try or do that will help you to really understand at an experiential level what is being discussed, and then some resources that you can follow up. I think, Dana, that's about all I wanted to say without really getting into the guts of it. I'm trying to think of how long did we say that the course took in total?
So we did a survey of the pilot session for those who were invited to take the course before it was publicly available, and the average number of hours that it took folks was 4 hours to complete. Because there are 6 lessons, you do get a certificate of completion at the end for 6 hours. There were people who did report it taking 6 or more hours, but the average was 4 hours. Yes.
Yes. So from my perspective, that's a very brief course, and it covers a fair amount of territory. As I said, the intention is to increase your awareness of these elements, to give you a sampling of what it means, and then to give you resources to follow up on if you're interested in doing more. And that was the sum total of what we had intended to present. I think we have another question to ask you. Have you taken this course? Not yet. One person. Okay, if you could please join us at this code, using this code. It would be lovely to find out how many of you have actually seen this course or taken it.
And I just put the link and the code back in the chat if you want to revisit that.
Okay, so 25 people have not started. 3 have finished. Congratulations to the 3 who finished. Terrific. We look forward to your input and feedback. Dana, should we talk for a minute about the follow-up?
The follow-up.
Our follow-up training beyond the online modules.
Yes, we are going to get to that when we get to the goals in just
Okay.
one second.
All right. Well, let me then just end this piece by saying I've given you a very short overview of this course and what the online modules contain. There is now the opportunity to carry this forward and get more into the content in greater depth. And Dana's going to talk to you more about that in a moment.
Yes, and it is great that there are some folks on today that have finished, but it's also completely fine to join the Family Partnership Training Institute without having started the course. The Family Partnership Training Institute is an extension of this course. It will be used as a key component of the Training Institute. And our goals for this training institute are to deepen your understanding of evidence-based skills that will result in authentic family partnerships. We're also going to have a space where you're able to reflect on your own beliefs and experience with family partnerships, and then use the strengths-based approach to developing effective partnerships. And then we will have your peers in that room each month where you can bring your own challenges that you're experiencing currently in your professional life or that you've experienced in the past related to partnering with families, and together we'll all brainstorm solutions. And by the end of the Training Institute, we hope that you will have built a toolbox that has resources, strategies, and skills to aid you in those authentic family partnerships. So you don't have to have taken the course already, because each month of the Family Partnership Training Institute will build off of one of those modules. So you'll have an opportunity on your own time to take that module or to refresh yourself on what that module was about if you've taken it in the past. And then we'll build on the skills that were introduced in that module in each session. And these will be 90-minute sessions broken into 3 different parts. Marianne, as the lead facilitator, will do a brief presentation on the skills that were introduced in that module. And then there will be time for role play and interactive exercises to help you develop just a better understanding of those skills and knowledge. We can't promise that you'll come out with a 100% ready to use new skill, but if you've learned about these skills in the past, we're going to just kind of piggyback on that and add a little more knowledge to that. And then the end of each session will be that group discussion where we'll review the new learning that has happened, and you can solicit advice about any professional challenges and brainstorm those solutions to the common barriers to family partnerships. We have already set the schedule for each session. They will be on Wednesdays from 2 to 3:30 p.m. Eastern. Our first session is in December. We're going to get to know each other and go over how the Training Institute will work and introduce those core concepts of person-centeredness and family-drivenness. And then the next 6 sessions are all about the modules, which we've already gone over. So you can see those dates there. Lachelle also popped a link into the chat. The dates are also there on the link. So you can go ahead and put those into your calendar if you are interested in joining the Family Partnership Training Institute. There is an application that is required to join. Our goal is that all of the participants in the Training Institute are with us for all 7 sessions. That's going to be the way that you're going to get the most out of this, and all of your peers will get the most out of it as well. So we are asking that you complete a very brief application. It's due on November 15th. There are 6 short questions about how you work with families and what you hope to gain from the Family Partnership Training Institute, as well as some just contact information. So Marianne, Gail, and I will be looking at these applications then that week after November 15th, and we'll get back to you on November 25th to learn whether or not you have been accepted. This is a small group training institute, so there is a competitive application process. So please do put some thought and answer those questions in a way that represents your experience and your desires accurately. And I think that if you'd like to pull out your phone and visit this QR code as well, you can get to that same link that Lachelle put into the chat. We do have some social media advertisements about the Partnership Training Institute, so share those out widely to your networks from the NFF social media account. And I think we're going to open up to questions now if anyone has any questions about this process. I'm just going to stop sharing so that we can see each other. can raise your hand or just unmute yourself if you'd like to ask a question.
Someone wants to know if there's a call. Dana?
Yes, you cut out there just a second. Is there a cost? No, this is completely free. Everything that we do at NFSTAC is free. That online course, the Family Partnerships in Behavioral Health, is 100% free and can be accessed by anyone. And the Partnership Training Institute, it will be as well. So we are looking to accept around 20 people total. This training is applicable for certified peer partners, yes. Oh, Kim, will we offer this again? Marianne, that's a great question.
Well, I'm sure we will. It won't be immediately, but perhaps we haven't discussed it, maybe in the fall or something.
We shall see. So our NFSTAC SAMHSA funding does sunset at the end of August 2025. We do hope that we will have another 5 years to offer these free trainings, but we won't know about it for a little bit. So we would love to offer it again if we get some more years of this technical assistance center.
Well, as someone said early on, they hold the hope in the relationship, and I feel hopeful that that funding will appear and we will be able to run this course again.
Yes, we do too.
Any other questions that you have, either about the approach, whether it's appropriate for you, anything else? We've gone through this kind of quickly.
I'm going to pop my email into the chat, and you are also welcome to email me with any specific questions that you weren't comfortable asking on camera as well. And again, we did record this, and we will be sending the recording and the slides to everyone who was a registered attendee, or even those who missed it too.
Hello, can I ask a question?
Yes.
I'm sorry, I'm on my phone, so I can't find the hand to raise.
That's
I'm
okay.
wondering, with such a small group that'll be trained, what is the ability to bring this skill back into our communities and be able to share with others? Implement it, of course, but sharing with others is my question.
I'll let you take that one, Marianne, because you're our facilitator.
Well, I don't think there's going to be a formal process within the course of training you to train others, because that would be an additional training program, and we did not design this for that purpose. If you use it with folks, your enthusiasm will spread it around for sure, and that has been true in my experience. And you will have the handouts, you'll have the PowerPoints, you'll have the online course that you can suggest other people take and perhaps answer some of their questions. So informally, you will be able to spread it around, but it is not a formal training of trainers.
Perfect, thank you.
Yeah, and Lisa, Marianne mentioned handouts. Like, we will be incorporating lots of resources that are freely available to the public from NFSTAC as well as other organization. And there are some great resources on that online course as well. So those are always great to spread around too. Barbara, there are not CEUs available. You will receive a certificate of completion at the end of the course, or the training institute rather, but there are not CEUs available, no.
I don't know whether this is appropriate to say here, Dana, but I know that in some disciplines, if you have objectives and you have a reading list and you have an structured course outline and the hours, you can submit that to the accrediting body, and sometimes they will give you CEUs even if CEUs aren't offered.
That is great to know. Tabitha, we are going to communicate with everyone whether or not they have been accepted on November 25th. So you can go ahead and mark down those dates on your calendar, but we will make sure to get all those dates on your calendar once you're accepted. So especially that December 11th date, the very first date, you might want to go ahead and schedule that onto your calendar if you are applying. Any more questions?
If you have no more questions at this point, I'm sure that should one pop up between now and the application moment, you could, I'm volunteering you, Dana, could shoot that question over to Dana, who could help you with an answer. Sometimes it's hard to think of all the questions you have right in the moment.
Absolutely. Yes. We think that this is going to be a really great group of enthusiastic folks working in behavioral health who have a lot to share as well. I know Mary Ann is just an expert on this topic, but we know that you all working with families right now have expertise as well. So we look forward to learning alongside you all.
Absolutely.
Well, if there are no more questions, then we can wrap it up. Mary Ann, I don't know if you have any final parting words for our potential applicants.
I think I would just repeat what you've said, Dana, which is that please check the dates and make sure that you can make it, because part of the discussion will be enriched if we have the same group from one session to the next. And since we are in fact learning alongside each other, having that kind of consistency would be very helpful to the course. Yeah. And I guess the only other thing I would say is that I look forward to meeting you all and spending time together as we try to figure this out together.
Yes, absolutely. Because this is a SAMHSA funded webinar, we do require feedback on just this information session itself. And I'm realizing just now that I did not connect this survey to the Zoom meeting. Usually our surveys pop right up when we close the meeting, but I did not do that this time. So if you could be so kind as to pull out your phone and scan that QR code. If not, no worries. I will be sending the link to the follow-up survey in the follow-up email as well. So please, that helps us out and shows SAMHSA how valuable our work is. If you do have a moment to take that survey, we would really, really appreciate it. And we will go ahead and close the meeting in about 5 minutes. The recording and slides will be sent to you within about a week. And we really hope that you apply. The training is all virtual, all online. And Lachelle has popped that survey link in the chat as well. You can grab that survey link. Thank you so much, Lachelle. Thank you very much for those that hopped on right at the end when we were doing our questions. We will have this recorded and on the National Federation of Families YouTube page and sent out via email within the next week or so. Thank you all so much.
Thank you very much. Mahalo.